Hi, joining us today on our episode is Ronnie Strickland, National Director for Remote Pharmacy at Cardinal Health, and Rachna Patel, Regional Director of Pharmacy at Cardinal Health. So, Ronnie, Rachna, what's something that we need to start doing here within the practice of pharmacy?
John, I think the COVID vaccine or COVID pandemic proved
Mhm.
to us that remote pharmacy service is a great model.
Sure.
There was a lot of resistance. Folks had a lot of resistance to using a remote model, but a lot
Right.
of people were forced to utilize remote pharmacy service models, during the pandemic.
Okay.
Hospitals that had had to utilize, work from home pharmacists because they were being quarantined because they had been exposed. So it really, one good thing that came out of the pandemic is that it verified and solidified the impact that remote pharmacy services can have, in a
Right.
hospital setting. And it doesn't just have to be a hospital setting, even in, a retail setting, in, an outpatient pharmacy setting.
Right.
That type of place is an excellent opportunity to utilize remote. So, uh, as far as things that, you know, people need to start doing in pharmacy is really, taking a look at that model, seeing where
Right.
that model can help. Reach out to myself or Rachna, and we can talk through, what challenges you have, and how we
Right.
can help you. So,
Yeah.
Rachna.
Thank you. So, to Ronnie's point, for the longest time, remote pharmacy services has been looked at as your typical overnight services when the
Right.
pharmacy is closed. But
Yep.
within the last, I would say, 4 to 5 years, we've really gotten innovative in the way we are able to service hospitals.
Okay.
We can provide daytime services working alongside the staff that's on site. This really allows John, the on site pharmacist, to be freed up from being tied down to a queue to going
Right.
up onto the floor, doing more clinical services, interacting with patients. I have an example. We have a hospital in which we're providing services during the day, and it's allowing their pharmacists to go up to the floors and do discharge counseling.
Oh, wow.
Med
That's awesome.
reconciliation is another opportunity, right, for
Right.
pharmacists to go and talk to patients and really be the person that can help bridge that gap between an ED admission to the
Mhm.
floor. So there are different opportunities for remote to help hospitals, and I think we really need to look at those different things as we're talking to hospital leaders.
Right. That makes a lot of sense. So really start expanding our thought process around how we could utilize remote pharmacy. And there's you know, most of the things can be done by remote pharmacists except, mix and be at the patient bedside. Right.
Exactly.
So, you might as well,
Right.
expand upon that. So, look, as we're expanding the uses for remote pharmacy, what's something that we should stop thinking about or stop doing in that world?
We in our world, we should really stop thinking of remote pharmacy services, as Roshan mentioned earlier, as
Hmm.
just an overnight service.
Right. Right.
We can work side by side.
Hmm.
To Roshan's point earlier about the account that she has where the pharmacists are doing discharge counseling, that particular
Right.
facility had the maximum penalty for readmission rates. So
Oh,
they were getting
ouch.
I think 3%. So
Ouch. Yeah.
of their CMS reimbursement. So what they were able to do and was to reduce that readmission rate significantly. So they
Wow.
were so successful with it. They were actually expanded that discharge counseling service to the other readmission penalty
Oh, wow.
diagnoses. So
Okay.
significant impact on that hospital, and the return on that investment is exponential on the
Right.
on the hospital side. So based on what they pay for the service
Hmm.
versus how it impacted and increased their reimbursement from CMS,
Right.
they're coming out way ahead. So we're not just an overnight model. We're
Right.
a lot more than that, and remote pharmacy services, should not be looked at as just that overnight service when I'm closed. So
No, absolutely. Yeah.
I think we're more of, we can be a resource in so many different ways,
Mhm.
John, for our hospitals. And I think that that's where we have opportunity to collaborate with hospital leaders and really show them our value, but also what we can offer to their on-site staff. I mean, as we know it, there's a shortage, right, of pharmacists,
Right.
of technicians. And so we, as remote pharmacy service provider, can really come in and help bridge that gap, whether it's a
Sure.
temporary gap or if it's a long term. There's definitely opportunity for us to help bridge the gap with the staffing shortages that healthcare across the board is experiencing.
Oh, absolutely. And you mentioned this earlier, Rachna, we were talking about, kind of expanding the use of this, but it all comes back to how do we increase patient education and making sure that the pharmacy and all the caregivers within the facility have all the information, whether it's from a med rec, admissions, taking that patient from the ED to the inpatient, and then frankly, discharging, right? So as we increase this, and Ron, that you talk about that CMS, if you bring that 3% down to 2%, that's a lot of money, and even further if you go down to 1%.
Yeah.
So it really
Yep.
is, as you increase your patient education, you increase your patient adherence, and that really decreases the readmission rate. Also helps with your HCAHPS scores, right? If I've got access to a pharmacist as a patient at the bedside, then I understand what my therapy is from the medication side and what I should be doing once I get discharged. So really I see a lot of value in bringing in that remote access to the pharmacy for sure.
Absolutely.
So we talk about,
Absolutely.
starting it by expanding the areas we cover, stopping looking at just staffing, but looking at it as a really a strategic addition to your pharmacy team. What do we need to continue doing? What do you think, Ronnie, is one of the most important things we need to continue as we take care of our patients?
Well, an old term that's been thrown around a long time is pharmacy as a strategic asset.
Right.
And there's, I think there's been some movement to, throughout the industry, throughout hospital leadership, to look at pharmacy as a strategic asset. And,
Right.
We need to continue to do that. We need to continue to expand and look at ways that pharmacy can impact,
Right.
the service levels, the patient satisfaction levels, as you said. I mean, it was back when we started the service that we were talking about earlier.
Mhm.
It was probably a novel idea,
Right.
but
Yeah.
we really need to continue to innovate and look at
Right.
the ways that pharmacy can be a strategic asset for a hospital, so that hospitals can see the value of utilizing remote pharmacy services to help leverage their on-site pharmacist for more
Right.
impact on the clinical satisfaction and and patient satisfaction levels.
Right, right, absolutely. And a lot of times, Rachna, you see, and Ronnie's right. People don't see it always as a strategic asset. They see, especially an inpatient pharmacy, it's a cost center, right?
Yep.
An outpatient and a retail can be a profit center. But looking at them in total, you really can see them, as a strategic asset. So, kind of building on that, Rachna, what do you think we need to continue doing in the practice of pharmacy?
Yeah, I think in order for us to show that pharmacy is a strategic asset, we've got to continue to collaborate with hospital
Mhm.
leadership, right? The
Yeah, for
C-suite,
sure.
bringing them to the conversation, showing our value as
Mhm.
pharmacists alone, and what we can do for patients, and for nurses too. I think hospital leadership has to be able to see, again, that pharmacy is a strategic asset, and having them at the table and involved in those conversations
Right.
and continued collaboration with them is the way that I think we're going to turn this around to be able to show the value that we can
Mhm.
bring.
Right. No, absolutely. And there's a lot of value that we touch the patient in so many different ways, as we talked about, from admission onto, within the inpatient stay and even post discharge, through our, medication adherence and programs to ensure that they understand what they're taking. So, Ronnie, Rachna, I really appreciate the time today. I know that you guys have, the patient safety at the forefront of everything that you do at Cardinal. So, appreciate it, and have a great day, y'all.
Thank you so much, John.
Thanks, John.